this cell, this tissue, let's put it to be, let's say this is going to be our skeletal muscle, okay? Like I tried to point out, your gastrocnemi are not busy. Mine pretty much is, okay? So as the blood flows, and that one red blood cell, because remember, at the capillary level, that red blood cell goes through the capillaries one at a time. So at that capillary level, because they are so small, that red blood cell literally gets squeezed through that capillary. Your capillaries of your gastrocnemi at the level of a muscle cell, do you think every single red blood cell getting squeezed is going to release its oxygen? No. How about mine? Sure on that? They're busy. I wouldn't want one of those muscle cells of the gastrocnemius not to be working. I kind of want them, I want them to be doing what they're supposed to be doing. So my oxygen is going to be getting dropped off. So now, think about that saturation level. My saturation level, that red blood cell, that hemoglobin, is going to release more of the oxygens. It might release 3 of the 4, where yours might be releasing only 1. So now, your cells are still producing CO2, is that correct? But who's producing it quicker? Me. Okay? So, the demand at that tissue level is higher. So, I'm going to have a lot more production of CO2 going into the blood. Yours is still going to produce CO2, just not as quickly or as high as mine, but my demand for oxygen is greater. Okay? So, when I'm producing CO2, one of the things that's happening, I'm getting my little H pluses, because everything has to go back to the bloodstream and stuff has to be dropped off. Okay? So now, what we find, based upon the oxygen being carried on the hemoglobin, which one do you think demands more oxygen drop-off? The one that is more acidic, H pluses, or less acidic? More. So, this connection will help determine how many of those oxygens are going to get dropped off, and then when it makes its way back to the lungs, will help determine how much oxygen will get picked up. Does that make sense? So pH created by the CO2 getting produced, all right? Because the CO2 is what is going to affect the pH of the blood, okay? So CO2 is the biggest determiner, because based upon pH, determining when oxygen gets dropped off the most. We tend to think of oxygen as the determining factor for everything. It's not. Your determining factor for oxygen use in your body will always be that pH created by the CO2. So, one of the things that I mentioned when we talked about the vessels of the body, I mentioned that our veins are reserved. Does everybody remember that? Because they are a blood reserve, okay, oxygen gets to stay behind. Important for an emergency situation. Okay, so something happens, all right? Okay, this time of the year, pools will be opening up, and unfortunately, someone fell in the pool, didn't know how to swim or whatever, they begin to drown. But they get rescued in time. But there's always, when you see an emergency situation like that, the need to restore that airflow. And there's a time limit on it. Have you ever noticed, like in shows and stuff like that? 5 minutes, 5 minutes, we got 5 minutes, 5 minutes, 5 minutes. Okay? Because on average, you've got about a 5-minute reserve for oxygen in that venous blood. And that is why they focus so hard on returning the airflow. That's kind of cool. If you think about it, that's why that 5-minute time frame is so important. This is a representation of the gas exchange, but note the terminology. Systemic. What level is that? Systems of the body. So this is showing that red blood cell traveling through the bloodstream, the tissues made up of cells to which it encounters, and the movement of materials. At this point, we want to see oxygen and what they're trying to tell you. Okay, whenever you see HB, they're letting you know hemoglobin, because that's how oxygen is carried. Okay, so what we want to see is oxygen get dropped off at the tissue level, because that's where we need to use it to make the energy. And then we need to pick up the CO2. They're trying to represent oxygen with the red arrow, CO2 with the blue. Note, the majority of our oxygen carried by way of the hemoglobin. A little bit can be dissolved, but that's not even 2%. The CO2, like I mentioned, keep mentioning, can travel in one of 3 ways. The largest is for us to have that enzyme from the red blood cell to break it apart. We buffer and let it transport. Some of it will transport by way of the hemoglobin on the globin portion, the protein. Some of it by way of a protein, the little globulin in the blood. But the majority, we buffer. Because that's why when they talk about buffer systems of the blood, this is one of the biggest they refer to, is the buffering systems of the body. So once we drop it off at the tissues, get all of that exchange, blood makes its way back to the right side of the heart. From the right side of the heart, goes to the lungs, our pulmonary circuit, where we're going to encounter an alveolus, all right, which hopefully is in good condition. We don't have any of those disorders that we mentioned, so that across this respiratory membrane, where we encounter the fluid, the water, we're going to have the exchange of the gases. And because CO2 is the most dissolvable, that one's going to move. But if I had the drop off at the tissues, where I only dropped off one oxygen from that hemoglobin, do I want to drop off the rest of my oxygens from that red blood cell? Or do I just want to pick up one more oxygen, let it be 100% saturated, and continue the circuit again? Do you see now why the difference is in the dissolving occurs? Because I may not need 4 oxygens on that one red blood cell. I may only need 1. And I can't have an overload of oxygen in the body. I got to make sure it's controlled to be carried on that hemoglobin to be effective to make it to the tissues of the body. Yes, no, maybe. It's kind of cool. When you, like I said, from now on, you probably will not think about your lungs and your breathing rate and everything else the same again. You'll probably think about, you'll probably pay attention to that inhale and exhale. The goal of this is to meet my metabolic needs. So, right now, the metabolic needs for me would be to help my skeletal muscles as I'm continuously moving around. And then, if I were to stop, okay, y'all answer a question for me. Ever had the professor that did this number? Adjustment to metabolic needs. Not all tissues need oxygen all the time. HB hemoglobin will respond to needs of tissues affected by 4 rates. Ambient pressure of oxygen. Where they sat right here, never looked at y'all, looked straight at the PowerPoint, read directly from it, never moved. And within 5 minutes, what are you doing? Because I remember that. I was very fortunate, for the most part, to have professors who were excellent. So, goal, meet my metabolic needs. So, that tells me that when I was sitting, my skeletal muscles didn't need that oxygen. It got decreased in need. But now that I'm back up moving, they need it again. And here's the cool thing. Because of the way that oxygen is going to attach to hemoglobin, the way that we're going to pay attention to the pH level of the blood, and therefore the production of CO2 in active tissues, oxygen demands can be met. So the more active the tissue, the more oxygen that can be dropped off. CO2 will get picked up in one of those 3 ways. Okay? So the rates, there are ways, these rates, that can affect the drop-off of the oxygen. It could be the ambient pressure. For example, what's the pressure around us? Remember how we talked about elevations? Okay. What is the temperature? Well, temperature tends to go up in our bodies. Remember that good old 98.6? But if we're busy doing something, temperature goes up. We're demanding more oxygen. Well, temperature goes up because temperature of tissues have gone up. For example, if you're moving the skeletal muscle, if you're moving, you're warming that blood, you're warming the tissues, and that's going to demand more oxygen because the tissues are active. We have something called the Bohr effect, which is based on the CO2. If the cells of the tissues are active, they're producing CO2. CO2 is going to affect the pH.